Greetings, family. It's Cassandra Floyd, also known as the daughter of the Fates, and I'm late. Whatever. I am going to be doing a quick read today from the book that we have been reading from for some time now, called The Parable of the Sower by the magnanimous Octavia E. Butler, seer, sibyl, master witch writer extraordinaire. This book is too good. So I'm going to be picking up where I left off yesterday. For those of you who have been following along, we are going to pick up today. We're going to finish reading this book in about 2 days. I've already marked off the rest of the book. Today we pick up on chapter 20, page 225. And I think we have 25. I think we only have 5 chapters left in the book, and the chapters are relative. Yeah, we only have 5 chapters left in the book, so we'll finish this book this week. I'm thinking we'll have the book finished by Thursday, and then, child, I'm gonna be reading another book right away, right out the gate, because I'm too hype about y'all hearing about this book, right? Man, IG. Ugh. IG been fucking up all morning. Anyway, so Thursday, either Thursday or Friday, whenever I finish the book, I'm going to start reading this book by Sower called The Great Black Mama of Creation, child. The Great Black Mama of Creation. Now, I'm going to read this book, but unlike the other ways that I've been reading in the past, because this book is so short, there's only 58 pages in the book. So because the book is short and I'm already currently facilitating another book club, I'm probably going to read this book and dissect it as if we were reading in a book club. So this book I will begin on Thursday or Friday. I think, let's see, today is Tuesday, so I have Wednesday. So it'll be Friday when I start that book. The Great Black Mama of Creation. So have your pen and paper ready because we're going to get in that one. All right. So if you have not already, please go to my YouTube channel, which is at Daughter of the Fates. At Daughter of the Fates on YouTube. Subscribe, like, share my shit. Okay. Also, watch the ads, make donations, hit the super chat or the super thanks or whatever those things are when you're watching. If you appreciate the content, these things make a difference. Okay. This is not for entertainment purposes. You know how people be like, this is for entertainment purposes only. That ain't what I'm about. I'm not here trying to entertain you. I'm not. I am here trying to jumpstart a goddamn evolutionary movement. I am here as a compliant participant to my mother's will, which is to set this shit off. That's why I'm here. If you're entertained in the process, fine. That's great. But know that why I am here is to set this shit the fuck off already. Everything that I do, whether it is reading the parable of the sower, and I don't even know if you noticed yesterday that I was actively taking notes while reading this book to you. So whether it's reading the parable of the sower, whether it's facilitating the book clubs for the book Pure Lust, which we finished in December, whether it is doing the readings online or for you individually, whether it is doing your consultations, your wellness and nutritional consultations, whether it is me cracking jokes and acting a clown. I am taking sitar lessons here. So soon, ever so soon, my first live event is going to be in July, playing the sitar. So whether it's me playing the sitar or the saxophone or singing or belly dancing, it don't matter. Everything that I do is tied, intrinsically linked to the execution and the fulfillment of my mother's will. Okay? So support my shit. Share my shit. Like, share, and subscribe. Make your little $1.99 contribution, your $2.99, your $5.99, your $20.99, your $29.99 contribution to at Daughter of the Fates, which is a project of the Temple of Evolutionary Emergence. Okay, that's my diatribe. Oh, support my jewelry business, because in supporting my jewelry business, you are supporting the Temple of Evolutionary Emergence. That's it. That's it. Everything that I do. See the earrings that I have made? See the necklace, the little goddess necklace with her little chakras illuminated that I have made? You understand? So I'm gonna need y'all to share, like, subscribe, forward to as many as you can. Sign up for the book club. You understand? Like, let's do this shit already. Okay? Now I'm gonna go ahead and start this my little diatribe, my little lecture for y'all today. There's a, you know what? It's not my only lecture for today. There's a lot on my mind, and I'm so busy today. Got to go file my goddamn taxes today. You feel me? Which is giving me a certain level of stress that I don't want to face. But outside of that, there's a lot going on in the world, man. I'm gonna be launching a podcast soon. And it's going to be centered around health and wellness, but not in a sterile kind of way. It is going to be centered around the political controversies that make up the health and wellness crisis in this country. So it's going to be pretty deep. You understand? I'm going to be playing some old interviews that I did when I was doing radio. And the show was called Colonialism is Bad for Your Health. So that should give you at least some insight about my approach, or the approach that I will be taking in talking about health and wellness. Yes, I will still give you little great tidbits of information about how to live better and how to live well and how to live optimally in a fucked up society. Because you can. You understand? But I will also be talking about, like medical apartheid, by like the book by Harriet Washington, or what is it called? Bad Blood, or Medical Revolutionaries. That'll probably be the first book that I read to you guys on this health and wellness channel, is Medical Revolutionaries, because we need to jump that joint off on a good note, because that's a great book, right? What is it? What is the other one that I think is really important for you guys? Yeah, I got a lot of books that we will be reading out of and discussing out of. The Molecules of Emotion. That's a great one. Very uplifting. You feel me? So anyway, I'll be doing that. And the reason I'm mentioning that is because I got an attitude right now. I didn't want to have it. I am going to do an introduction because I got an attitude. And this is what has prompted me with a certain sense of urgency to launch this podcast. I have an attitude, and I try not to have an attitude about this particular thing, because from day one, I understood where people's emotions were coming from, where their fear was coming from. I understood where their obsessive behavior was coming from. And I honored that, and I gave space for it, because these diabolical motherfuckers that we deal with, called the United States government, called white supremacy, called patriarchy, called the World Health Organization, called the CDC, you name it, called the American Medical Association. You understand? All of these diabolical institutions, really love fear. Fear is like It's their driving force. Fear and panic is like the secret elixir that gives these bitches life. Really. You understand? Fear, baby, is what gives these bitches life. And I know that and I recognize it. So when we entered into pandemic, in 2020, you can go back because I started doing lives around that time. As a matter of fact, the first one that I did was 7 ways to boost and build a strong immune system. That's all I said, because people, all my friends, all the people that I know was like, why you ain't talking about COVID? Why you ain't talking? I was like, because y'all ain't about to get me jammed the fuck up. I can talk around COVID. You know what I'm saying? I was like, but while people are gripped by fear, while fear is the dominating force on this planet right now, and I know the nature of the state, baby. So you ain't gonna sway me. You feel me? Even before COVID happened, these motherfuckers was ghosting alternative practitioners left and right. There was more than 200 alternative practitioners throughout the United States of America who were dying under mysterious circumstances because they were outspoken activists around this issue or that issue. And I interviewed several of them. As a matter of fact, Christina Marjorie, who wrote the book, What If Everything You Knew About AIDS Was Wrong? That's the book she wrote. What if everything you knew about AIDS was wrong? I interviewed her, this woman, Christina Marjorie, and wanted to do a follow-up interview with her 6 months later and called her phone, and her husband answered and was like, you didn't hear. Oh, she died. That happened. You feel me? I've interviewed, what was his name? Dr. Peter Duesberg, Dr. Carrie Mullen, Dr. What's his name? So I interviewed some really radical, what some people would call fringe activists around, serious health issues, controversies, conspiracies in this country. I interviewed several times, 3 or 4 times, Dr. Betty Martini, who runs an organization called Mission Possible, which has been for over 30 years fighting like hell to get aspartame removed off the market for human consumption. She said, this is an old lady. This woman got to be in her 80s. You feel me? Cute little Southern Georgia Belle. You feel me? Talking about how over the years she has had death threats. She has had attempts on her life for talking about getting aspartame removed from the market for human consumption. So while COVID scared a new generation of humans, not only was I not scared, I had, as a healthcare practitioner, I had a healthy respect for people's fear. So I wasn't disrespectful. I masked up, I masked in public, blah, 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 blah. But what I wasn't going to do was to yield or concede to a narrative that to this day, there ain't no evidence. There is no article I've read, no peer-reviewed journal article I have read thus far that has convinced me anything other than what happened in 2020 is no different than what happened with AIDS. And you have to go back to my videos to see my position on AIDS. You understand? And it's not a coincidence, because the same motherfucker responsible for the terror tactics initiated during COVID is the same motherfucker who governed the entire process of HIV causing AIDS and all of these terrible drugs that were killing human beings. Fauci was responsible for both. So I already out the gate was like, no amount of vaccines that they concoct over the fuck night, because that's what happened. They concocted them goddamn cocktails overnight. Where they come from? Who did they test them on in less than a year? You feel me? Where them people at? They still alive? The test subjects? How did they develop a vaccine so fast when it usually takes 2 to 3 years to develop a goddamn vaccine, if not longer, and then another year of testing before they approve it for human distribution? That didn't happen. I was like, no, y'all can miss me with that. Y'all can miss me with all of it. Now, while I am in proximity to other human beings, I was living in a house full of people, you feel me, who were terrified. Cool. Wipe the doorknobs every time you leave a room. Cool. I didn't have no problem with wearing the mask. And in the whole period of time that we were in the peak of COVID, I ended up hospitalized once, thinking that I had COVID, and I did not. I was like, how the fuck I got COVID? You feel me? I did not have COVID. I had a triple infection of my upper respiratory system from mask wearing. This is the only time I ended up hospitalized. I'm going off on this. I don't know how. I'm going off on this because I've got an attitude. I understand and I respect people's concern and fear. But this woman who I care about has not just, because this has been an ongoing thing. Now, I'm like, when we hang out, when we're in proximity to each other, I will do the things that make you comfortable for us to hang out. So every time we would get ready to hang out, I would, a couple of days before, take a COVID test. I would wear a mask, went to the damn place that she sent me to get boxes of masks for free, boxes of tests for free. Every time we kicked it, I would test before we kick it, and I would wear a mask before we kick it. You feel me? All of a sudden, I am throwing an event, and she gets an attitude telling me if the event is not mask mandatory, I'm not coming. I was like, okay, that's fine. I was like, but I'm not going to make it mandatory. We will have a masking station. We'll have a COVID station where people can do their hands. If they want to take a test, cool. If they want to wear a mask, cool. But I'm not doing that. I'm not doing that. I'm not doing that. You feel me? Not just that, I was traveling the whole time COVID was happening. I was in Memphis. I was in Mississippi. I was in, where else was I? North Carolina. I went to Atlanta 2 or 3 times. You feel me? Where else did I went to Alabama several times because my mom and them lived there. I went to Florida several times. You understand? And people can say what they want to say, and we haven't done an honest assessment about what happened during COVID. Long story short, this young woman, I was trying so hard to be patient, yo. This woman gonna tell me, I mean, listen, God damn it. We still in a COVID peak. People are dying every day from COVID. Going the fuck off. I am. I said, look, baby, I understand your concern, but this is the problem. With COVID, there was no logic tied to anything that we did. None. No logic. But because people's fear was intense, and because of the type of medicine that I practice, and I understand the impact that fear has on people's immune system, on their fucking respiratory system, on why their hair was falling out, and all of a sudden people with no hair problems, no issues whatsoever, are being diagnosed with alopecia. They didn't have alopecia. They were suffering from severe acute shock, fear, and fright that was taxing the hell out of their kidneys, which governs their head hair, which makes their fucking hair fall out. I lost half my hair during COVID. I know it still look like I got a lot of hair, but my hair was past my ass when I moved to this state. You feel me? People's hair was falling out in chunks. I'm convinced to this day that's what Jada Pinkett Smith suffered from. Not, quote, you gonna live with alopecia the rest of your life. You had extreme shock, fear, and fright, damage to your kidneys, which attacked your head hair. Damage to the kidneys will impact the function of the respiratory you know what? I might have to change the title of this. I'm still gonna read this book to y'all, but I got an attitude today, y'all. This motherfucker gonna be on my shit trying to teach me something. I said, look, girl, I have a healthy respect for your fear. I have a healthy respect for the fact that you are immunodepressed. I said, but so what y'all want to do? Y'all want the whole world to wear a mask for forever? And I know I ended up in the fucking hospital for a week from mask wearing. I'm just telling you, and I wasn't the only one. So don't nobody talk about that. Don't nobody talk about the fact, child. Anyway, I said, but the second of all, Motherfucker, I have 4 degrees in medicine. I don't need a lecture from someone my children's fucking age about how I am being genocidal because I do not concede to wearing masks every time I walk out my front door. Oh, yes. There's a whole line out there now that we are no different than Israelis in their assaults against Palestine if we refuse to wear masks in public. It's gross. It's fucked up. It's obscene. You motherfuckers do not read peer-reviewed journal. Y'all don't read. I did goddamn 10 years of medical school. To have somebody who has probably read just in the last 2 years a few articles, a few peer-reviewed journal articles, gonna lecture me, and they're gonna tell me I just don't know if I can be friends with anybody who doesn't practice what they preach. Who the fuck don't practice what they preach? Explain, because I have never conceded to this bullshit around COVID. Never, not from day one. My daughter is not vaccinated. My grandchildren are not vaccinated. And 2 things can be true at the same time. Multiple things can be true at the same time. Well, I recognize that people were sick and that people were that people were dying. People were also being made ill. So you listen, people were also being made ill. That illness was being exacerbated by imposed isolation, people not being able to be with their loved ones while they were transitioning, people not being able to support their loved ones while they were sick in the hospital. My daughter was in the goddamn hospital for 3 days by her motherfucking self, delivering a baby 3 weeks after lockdown because they wouldn't let me and my mama to the fucking hospital. So I understand, but I also understand the impact of acute, sharp emotions on your physical body, manifesting as sharp, acute symptoms. There were 3 different ways, aside from this mysterious virus, 3 different ways that our lungs were being assaulted during the height of pandemic. Ain't nobody talking about that. I know that because of what the fuck I do. So I had a real problem. I sat with this shit for a few days. This girl and this fucking vile ass way she was speaking to me about my refusal to wear masks outside my house. I was so offended in so many ways. One, because we were friends, she was too comfortable in how she was speaking to me. Girl this and girl that. Bitch, I'm 50 years old. I'm 50, first of all. And we may be friends, but when you are challenging me, when you are condemning me, when you are attempting to shame me about how I present in the world, about how I choose to care for myself and others out in the world, now we have a problem, and girl is not the appropriate language to use. You understand? So I'm gonna tell y'all something real quick, then I'm gonna leave y'all alone and read this book, but I had to get this off my spirit today, yo. It takes a lot. It takes so much to make me angry. And again, I prefaced by saying I have given a gargantuan amount of leeway for the last 4 years because I recognize and understand what fear does to human beings, how fear makes people behave, how many people will cut human beings off from their life under the auspice of living in fear. I get it. And as a healthcare practitioner, I respect that. And every time I put my hands on people, I am always attempting to allow their sovereignty to dominate the space. Whatever it is you need for me to do to make you feel comfortable in the space where you're coming to get something from me, tell me what that is. So every time this woman came to my house, every time this woman came to my practice, every time we kicked it, I was doing the test, the rapid test, and I was doing and I was masking the whole time that we were together. And she gonna come in my inbox with these outlandish and outrageous and utterly, baby, when I tell you the last straw was her posting a video of some woman talking about how people who refuse to mask in public are no better than Israelis and their attack on Palestine, that you can crystal clear see what is happening in Palestine as a genocide, but you don't consider yourself having genocidal behavior when refusing to wear masks in public. Y'all, you cannot make this shit up. You cannot. Don't take any personal responsibility for your health outcome and why. Ask the deep and penetrating questions why you are immunosuppressed in the first place. And if you were immunosuppressed before COVID, can COVID be the explanation? Because listen, I done worked with people doing the health consultations that I do, the whole wellness consultations that I do, and I give them everything. Whatever their condition is, they get a whole write-up of everything they need based on the diagnosis that I provide for them for the system of medicine that's damn near 6,000 years old, that I spent 10 years in medical school learning, another 10 years practicing. You understand? So when I tell people what the primary contributions or contributing factors to immunosuppression are, they don't want to hear it. They don't want to hear that because it means actively doing something on your own. You aren't born well, some people, maybe 0.5% of the whole population are born immunosuppressed, but even that has a cause and a resolution. But if you have become immunosuppressed, there are at least 3 direct contributors to why you are immunosuppressed. And it ain't because a bitch ain't out in the world wearing a goddamn mask under the guise of respecting the immunosuppressed around us. I like the logic. I cannot. Do you know what I did? I lived in a house during pandemic with 6 other people. I lived in a house with 6 other people. You understand me? Every single one of my roommates developed or contracted, if you will, COVID. Every single one. And in the 2 years that I lived with all 6 of those people who contracted COVID, do you know I never got COVID? Not while living with them. Do you know I never got COVID? Living in close proximity with human beings who all had COVID. You know what I was doing 3-4 days a week? Hiking, unmasked. In the woods. Camping twice a month throughout the entire pandemic. All you got to do, go to my Facebook page, look at my folders. Twice, sometimes 3 times a month, hiking. No, camping. Hiking, I was doing 3-4 days a week. I was going hiking I was still working outside the house. I was the only one not working at home. I was still going in other people's houses, working in other people's houses. I was working 5 days a week, hiking between clients. That's what I was doing. I was outside breathing the air is what I was doing. While everybody else was stuck in their houses, not touching each other. Issue number 1 with skin deprivation, skin starvation, and touch deprivation and its impact on the lungs, right? So I was going outside breathing air. I was hugging people. I was still having sex. I was still on Tinder. While everybody else was saying, I'm coming off this shit. I'm not touching anybody. I was still having sex regularly. Do you understand? Immune booster, solving skin starvation and touch deprivation, breathing, fresh, clean, unmasked air. And for 2 years living in a house with 6 people who had COVID, I never got COVID. You feel me? Because I know science. I am a scientist. 10 years of medical school allows me to say I am a scientist. I'm not, quote, just a healer. People want to diminish what healing work is. Bitch, I got 4 fucking degrees. 2 bachelor's degrees, a master's degree, and associate's degree in medicine. And no, not just alternative medicine, because y'all want to demote the significance of that too. No, in Western medicine too. I've read the entire Merck manual. Studied the entire Merck manual. Know every single contraindication between Chinese herbal formulas, Western hemispheric herbal medicine, and modern, the first 52,000 modern medical pharmaceuticals. Don't be trying to teach me shit. Be trying to shame me based on the handful of articles you read, and now you done become an expert on COVID, but you don't know nothing about Fauci. You don't know nothing about the controversy around HIV and AIDS and how many millions of people died as a consequence, not of HIV and AIDS, but of false ass, bogus ass medicine science developed to do what it's always done in this country, at least, which was to profit off human suffering. That's what it was designed to do. It was to profit off human suffering. Now, if you can just read the common narrative, well, this is what the CDC says. This is what the World Health Organization says. This is what the American Medical Association says. This is the standard practice of care during pandemic. Okay, fine. Read all you want. I've never shamed anybody about their position. Even when patients would ask me, have you gotten vaccinated? I would ask them, why are you asking? If you are asking because you want your practitioner to be vaccinated, then I will tell you. If you are asking for my personal, for personal reasons, then I will decline telling you. But if you're asking me because to establish, a system of health, a practice of health care for yourself, you need to know if your practitioner is vaccinated because that's what you want, that's what you prefer, then yes, I will tell you, I am not vaccinated and you need to seek the care of another practitioner. I got no problem with that. But when I had friends and family, because I'd been doing radio around health issues for 6 years, asking me, what's your opinion about COVID? Why you ain't saying nothing about COVID? This is the first time y'all can go all the way back. All the way back to 2019 or 2018 is when I started my YouTube channel. Y'all can go all the way back. Even at the height of pandemic, I never even said the word COVID on any of my videos. Any of my health videos that I did at the time were centered around how to care for yourself, how to keep yourself well in the height of this, how to navigate difficult conversations with people, whether that's professionals or family and friends, about your position and how you decide to initiate self-care, because there was a lot of shaming happening during the height of pandemic. Again, it was centered in people's fear, a rational, legitimate fear of this thing that was happening. And it didn't happen on a fluke. It was constructed, it was developed, it was purposeful, right? Now, if you want to understand why I'm saying purposeful, then go back to my videos on when I was teaching the workshops on America's First Pluto Returns, because that happened. The pandemic began at a period in time, and y'all always be playing games, man. Take astrology seriously, because your opposition takes astrology seriously and is always plotting and scheming against you based on these astrological movements. Literally, let's see, 6 weeks before we went into pandemic, a major astrological occurrence that had not happened in 518 years actually fully predicted, guaranteed a megavirus, guaranteed the unleashing, because that's what happened. It didn't just mysteriously appear on the motherfucking terrain. It was unleashed on human beings. That's what I'm saying. What y'all call predictions, I call orchestrations. Okay? What y'all call predictions and seeing into the future is being able to read the past and see echoes all along the past. These aren't predictions. These are orchestrations. These are planned, mathematical, calculated strategies. So I'm not going to digress too long, but I just wanted to say, man, my spirit was really disturbed. She going to tell me, how can you say you love me when you don't give a damn if I live or die? Because I will not wear a mask in public. Honey, my Wei Chi is strong. You understand? And if yours is not, and I have told you over and over and over and over and over and over again what the contributing factors to your immunosuppression is, and you don't yield, you do not comply, you do not do the things that are calculably necessary for you to regain control over your body and your health, that's on you. That's on you. You want to live with an identifier as immunosuppressed for the rest of your life? That is a decision that you are well within your rights to make. But to impose this weird ass behavior on others, And just because I don't talk about it, because I know how the freaking American medical fucking mafia behave and act, don't mean that I do not keep abreast of the information. I was so offended by her arrogance and audacity to attempt to not only shame, but present like she knew more than me. Bitch, show me your motherfucking credentials. God damn it. Now, I don't be playing no games like that. I don't be talking like that, but I got an attitude today. Know your lane. Know your area of expertise. And then behave accordingly when in the presence of others. And y'all all do that, by the way. Y'all all do that. Y'all all assume that Black femaleness gives you a right to challenge, because y'all talk about it with men. Y'all can see it crystal clear when it's men. I see all these little lives all the time about how it's messed up that a woman with 3 degrees will still have a dude who didn't graduate high school feel like he is better equipped to challenge her, but he'll never challenge somebody that is male in the space. Y'all say that all the time. All the time. I see all these cute little, lives and TikToks about how women who are professionals, who are trained in an area and still will have the audacity of somebody nowhere near their level, but because they present in space with a penis, feel that they are entitled to challenge this person's profession, challenge their professionalism, challenge what they know, right? With no background in the topic or nothing. But y'all all do the same. All of you, even those of you complaining about that and can see that crystal clearly, y'all all do that to Black women. Y'all all do it. Y'all, I told her, I said, imagine me and this girl been kicking it for like 4 years, 5 years. I said, imagine the audacity of someone. First of all, this girl can't be but a year older than my oldest child. Imagine the audacity of someone, first of all, who has no background in science whatsoever. That ain't what your degrees are in. Her lane is her lane, and she dope in what she do. Right? But this is my lane. No degrees in anything scientific whatsoever. You ain't but a hot second older than my oldest child. You understand? No social equity, even comparable to mine. You feel me? And you ain't African. You ain't Black. So all of these, and I said that. I said, imagine the audacity of you challenging a Black woman with 4 science-based degrees. Science-based degrees. And girl, you can't possibly care for me if you refuse to wear a mask in public, or if you refuse to organize events that are mask mandatory. I said, build your own shit. If it's that deep to you, build your own shit. But I set the terms for the shit that I'm building. Now, I have said that if people want to wear a mask, I will have a masking station. I will have a COVID conscious station. But this is my shit. And if you don't want to be there, that's fine. I said, I may even consider doing an event that is exclusively for special populations, people who are immunosuppressed or immunocompromised. We don't want no special event. Well, then get the fuck off my page. Get the fuck off my page. How about that? Build your own shit. If it's that deep to you, build your own shit. But this whole movement, calling someone like me, listen, I'm telling you, it takes a lot for me to get to the point where I say I want to throw down. To call me or anybody else who has taken charge of their health. Yeah, I'm a big girl, but I'm healthier than most of you. My blood work says so, that I get every 6 months, that my doctor still stays amazed by. How do you not have this and this and this and this? Because I'm a big girl, so I'm fat, so it automatically is synonymous with I'm gonna have a whole host of health contradictions. Nope, no high blood pressure. Nope, no diabetes. Nope, no syndrome X. Nope, no thyroid issues. Nope, none of that. My triglycerides are better than most of you. You feel me? I'm not immune compromised. I'm not immunosuppressed. And the only issue that I've had in the last 6 years that I've been in California was when I went to the hospital because my throat closed the fuck up And I'm thinking, oh my God, I either have strep throat or I have COVID, and I don't know how the fuck, right? And it felt like I was choking on something. And I get into the emergency room. They do a rapid test. They have to, and I was upset, y'all. I was upset. I'm going to change the title of this. I'm going to do a reading for y'all later. I'm going to have to change the title of this. I was upset though, because I don't go to hospitals. I don't trust doctors. I don't. And I have a valid reason. Most Black people don't trust doctors, but all they have is their intuition. And that's a healthy intuition. But all they have is their intuition to teach them why they shouldn't trust doctors. Bitch, I worked with doctors. I did my externship in an emergency room and in a fertility clinic. And I was taught by Western medical doctors as well as alternative practitioners and doctors. I know the history of the American Medical Association. Now that's a discussion we can have a whole nother day that'll peel your wig back. But I know the origin, the creation, the purpose for the American Medical Association, founded by the Rockefellers. You understand? So I have at least 150, if not better, 300 years of human history and the origins of Western medicine to have a very logical, science and historically based opposition to doctors and hospitals and Western medical institutions. So when I was in a situation, that doesn't mean I don't have a healthy respect for certain attributes of Western medicine. If I get shot, I'm not going to my acupuncturist. I'm going to the emergency room. Emergency medicine in the Western world is superior. It's great. If I get, if I have a heart attack or some shit, I'm not going to my acupuncturist. I am going to get myself out of immediate peril in the emergency room with emergency response medicine. And then as soon as I'm in the clear, then I'm going to my acupuncturist. Then I'm going to my alternative healthcare professional. Because what Western medicine has accomplished in emergency medicine, which is wonderful and saves a lot of lives, it fails across the board in chronic care. It fails across the board in chronic care. All the way across all the markers, it fails. You understand? So I have a healthy objective position about both these things, right? About the importance of emergency medicine and Western medicine in certain attributes, and then the absolute total dismal failure of chronic care in this country, right? So I ended up in the emergency room. I ended up in the emergency room Christmas Eve of 2020. And by the time I got to the emergency room, and plus being in the emergency room, if they don't see you bleeding or gushing blood out of your eyes or your nose or your mouth, you can sit in there for forever. So I'm sitting outside because they had all these like outside tents, even though there was nobody out there. They had all these outside triage areas set up. There wasn't but two of us out there. A dude was already on a gurney. And I'm sitting there and everybody keeps walking by me like they're so busy, but there ain't nobody in the emergency room waiting room. And there ain't but two of us out in triage. And these bitches just keep walking by me. These nurses keep walking by me like I'm not sitting there. I'm like, excuse me, can somebody come and take my vitals at least? Because this went on, 30, 45 minutes where they just kept coming out, walking out, and then coming back in, grabbing shit like they so busy. And I'm sitting outside. It's December in California, so it's cold. It's not freezing, but it's cold. And my throat was getting worse and worse and worse to the point where I was struggling breathing. And it wasn't respiratory. It was my actual throat was swelling up. And then it started feeling like I was choking on something. It kept feeling like, I'll be honest, it felt like a serpent or something in my throat. It felt like a small creature in my throat. I know it's crazy. I was like, look, something is fucking wrong and somebody needs to take my goddamn vitals. I said, I've been here 45 minutes. Nobody has even checked my blood pressure. man. The last thing I need is to have a stroke out here in the goddamn parking lot triage because you motherfuckers couldn't stop long enough to do a 3-minute blood pressure check. Child, she's like, well, tell me what's wrong. She's standing about 6, the nurse that finally stopped after I had to act a whole ass, like I'm cussing and everything. The woman is standing literally about 6 weeks away from me. I said, I'm choking on something. Something is in my throat and it feels like a worm or a snake. She was like, what? I said, I'm telling you, every time I swallow, I'm choking, I'm gagging. She said, well, take your mask off. And she's about 6, maybe 4 to 6 feet away. And she said, well, open your mouth and stick your tongue out. And she was like, oh my God. You hear me? That was her face. Oh my God. Grabs my arm and drags me into the emergency room and puts me right in a bed. She was like, I need all the nurses here now. There were 6 nurses gathered around my bed and a young white female doctor comes into the room. Now I'm freaked out. I'm like, oh my God, what the fuck? I mean, I was already panicking anyway, but she was like, oh my God, and put me right in a bed. And all of a sudden, all these nurses are surrounding the bed. The doctor comes in and she was like, well, open your mouth and let me see what's going on. She said, you have something in your throat? I said, yes. I opened my mouth and the doctor was like, holy shit. That's what she said. Now, meanwhile, ain't nobody saying shit about what the fuck they see that's freaking them out. So I'm only getting more freaked out, right? I hold out, but she was like, holy shit. I said, what? She was like, I don't think I've ever seen this in practice. I was like, okay, what already? She was like, you have uveitis. I said, what? As soon as she said, you have uveitis, those nurses all stopped what they were doing and they were like, what? And they all started to look. They all wanted to see because none of them had seen it. I'm telling you, you can't make this shit up. None of them had seen it. My uvula, you know, the little dangly thing in the back of your throat, had swollen, but in its swelling, it was elongated. It was 3 inches long. What I was gagging on that felt like a cervix, that felt like a serpent, was my uvula, y'all. My goddamn uvula. She said, so they tested me for everything because I had the little like white polyps in the back of my throat, which is what made me think I probably had strep throat, which is why I went to the emergency room in the first place. I was at home and I opened my mouth because I was like, there has to be a reason my throat is hurting this bad. And I had done everything. I had been doing acupuncture on myself. I had been doing everything. I had been taking every herb I knew to take. I was doing gargles. Nothing was helping. Nothing was easing it at all. So when I saw the white polyps in my back of my throat, I rushed to the emergency room because I didn't want to infect anybody else in the house if I had strep throat. Told my roommate, you know, everywhere that I went in the house today, you know, bleach it because I think I have strep throat. So I go to the emergency room and this happens. And so I told the doctor, I said, I think I have strep. And she said, yeah, I see all the white polyps in the back of your throat. So they did a strep test. They did everything. They did a strep test. They did a rapid COVID test. They did everything. She comes back and she was like, woman, she's like, she said, there's only one thing that I've been hearing about recently that causes this kind of infection. Oh, and the other thing is the infection had gotten so bad, so rapidly, had increased so rapidly that I was having an allergic reaction to the infection. I had so much infection in my throat that I was having an allergic reaction to the infection. I was swelling up like I had a bee sting. I'm allergic to bees. And I've only been stung once, but I swell up. My whole body swells up. My lip, everything swells up. That's what it felt like. My skin was getting so tight, so fast, and my clothes were getting like that fast. My clothes were getting tight. They had to cut my clothes off of me. They had to take shears, y'all, and cut my shirt off me and cut my motherfucking pants off of me. I was swelling so fast. So the allergic reaction to the infection was why they had to, I'm telling y'all the story for a reason. Okay. They had to stop the swelling because my throat was closing up. They had to put me on a steroid drip. I've never in my entire life, from childhood to that day, had taken any type of steroids, no topical steroids. And I had psoriasis really bad as a kid. No topical steroids. My mom refused. I refused. I don't know if that was her intuition or what, but I never in my whole life taken a singular steroid. And after I knew what I knew going through medical school, I conceded there would never be a reason that would be urgent enough for me to need steroids. That day it was. They put me on a steroid drip for 3 fucking days, and I was distraught because I know what it does, right? So then she's explaining to me that what they have been seeing is that people who were using, you remember they were making the cute little cloth masks, maybe about 6 months into COVID, everybody was tired of wearing the regular mask. So they were hand sewing, cloth masks and putting the little inserts in them and all of that stuff, that people were not washing them efficiently. People were just throwing their masks in the washing machine, and that wasn't enough to kill the bacteria in the cloth masks, that they actually needed to boil the mask and put dishwashing liquid in the boiling water, to boil the mask first and then put it in the washing machine. So she said what she had been reading across the country was there was a rise in upper respiratory infections, particularly the 3 that I had 3 infections at the same time, bacterial infections. I had uveitis and pharyngitis. Uveitis, laryngitis, and pharyngitis all at the same time. She said the only thing that could have caused this is mask wearing. Either people, not just the cloth mask, by the way. For a long time, people would take their masks. They're like, their medical grade approved, I forget what they call, like N15s or whatever, mask. And you know how they was doing back in them days, right? You would have your mask. You were only putting it on to go into buildings or stores or whatever. So people would hang their mask like on their rearview mirror or put it in their glove compartment. And then they would throw it on real quick to go into the store or whatever, and then take it off and put it back in there. And then maybe after a day or maybe 2 days, they would throw that mask away and get a new mask. Even the reusing of the masks was causing bacterial infections, which made sense. Not some mysterious shit. It made sense. What do they say? There's more bacteria in your mouth than anywhere else. And if you are not constantly keeping that bacteria in check, then breathing into a mask, all them bacterias, putting it in your rear view mirror where the sun can let them little bacteria percolate, or putting it in your glove compartment in a dark environment where them bacteria can multiply and percolate and strengthen. And then you put the mask back on and you're inhaling them supercharged bacteria directly into your mouth, nose, and throat. So she said at the time there was an uptake in articles and peer-reviewed articles coming in from all these medical institutions saying that there was a huge spike in people developing uveitis, laryngitis, and pharyngitis and laryngitis more than anything. And so I became very, very, very methodical about how frequently I was changing out masks. But that's how I ended up in the hospital. Okay. Now, I am the type of person, have always been. In my adult life, in my adult years, I'm 50, almost 50. In my adult years, I can literally probably count on 2 hands, less than 2 hands. Yeah, less than 2 hands, not 10, but more than 5. How many times I've been sick. When I say I have a strong Wei Qi, when somebody says you have a strong Wei Qi, it means you have a strong immune constitution. I have a strong Wei Qi, always have. My kid, my daughter that I gave birth to has a strong Wei Qi, always has. Feel me? So when I tell you, before I ended up hospitalized for wearing a mask, I had not been sick since 2016. Not even a common cold. I had not been sick since 2016. And when I went into this hospital And not only did they have to put me on a goddamn steroid drip, child, I was dismayed, baby. I was subdued. I don't say that often, but being on that goddamn steroid drip for 3 days, knowing what kind of turmoil it was causing in my body, I was dismayed. I was dismayed. And then they kept trying to put shit in the drip bag. They would come in while I was sleeping and be like, trying to put some, I was like, whoa, what are you putting in here? Oh, this is just something for your digestive system. I said, I ain't coming here. I ain't in the hospital because I got digestive issues. What you mean you about to put something in my goddamn? They did that. And you have, baby, that's why I don't trust doctors. These bitches kept coming into the, because mind you, this is the height of COVID. I was in that goddamn hospital by myself. The place looked like a goddamn morgue. There was no living beings in the hospital. You feel me? So I'm in there by myself. Couldn't nobody come and visit me. You feel me? For 3 days, Christmas Eve, Christmas Day, and the day after Christmas. My daughter and my grandchildren literally had just moved here, spending Christmas Eve, Christmas Day, and the day after Christmas by themselves with my roommates because I was in the goddamn hospital. Right? And so, these women, these nurses, it's like they trained to do that shit. You have to really be an advocate for yourself. First, I had children, so I sleep light as fuck anyway. A cough and I'm up. What's wrong? You feel me? So these women, they would only do this shit while I was asleep. They would come into the room, creep into the room, trying to put shit in my motherfucking bag, my IV bag. This woman was like, oh, I'm going to put some Nexium in my IV bag. I was like, the fuck I need Nexium for? She was like, well, it's just a precaution for, I ain't in here for anything that even closely relates to digestive issues. The fuck you putting Nexium in my IV bag for? I was like, get out, go. I don't need that. I said, from now on, you tell everybody that they have to announce to me what they're trying to put in my IV bag before they put shit in my IV bag. Over and over and over, that shit kept happening. Well, this is just, so 2 things that I had to take, that I had to take because the infection was so bad. I had to take an IV antibiotic. I was even more dismayed about that, child. God damn, I was so distraught. I had not taken an antibiotic of any kind in 15 years. So neurotic about recolonizing my gut with good bacteria and making sure not to eat food that had steroids. 15 years, I had not taken an antibiotic. And I ended up on an antibiotic and a steroid drip for 3 days. I was subdued. You understand? So that was the only thing that I consented for them to give me, was this steroid and this antibiotic. The steroid, what they had to get, there was no choice. That was the only way to stop what I was going through. Anaphylactic shock is what was happening. And so they used the steroid to prevent any further damage, right? And then I ended up in that hospital for 3 days, going literally daily, hourly to war with these nurses, trying to put all kind of fucking miscellaneous shit in my goddamn bag on the sly. Did they get paid to do that? Did they get kickbacks for doing that bullshit? Like, why they do that? I was mad as fuck. But anyway, let me tell you why I'm telling you this story about how I ended up in the hospital, not with COVID, right? Is because I lived in a house with 6 people who had fucking COVID in the house. They weren't hospitalized. They was fighting COVID at home. In the house I lived in. And in those 2 years, I never got COVID. I end up in the hospital December 23rd of 2020. And 3 months later, I get COVID. Because the sister Tina Cole asked me, what do steroids do to the body? Does anybody listening, put your answer in the comment section. Does anybody listening know why steroids work? Why steroids are used? What primary number one purpose of steroids is? No matter, glucose steroids, corticosteroids, doesn't matter. Whatever the topical, internal, inhaling, what is the purpose? What is the medical purpose? of steroids, the number one medical purpose of steroids? Anybody know? Short answer. Anybody? Anybody here on IG watching? Anybody know what the medical necessity or purpose of steroids is? The number one. Nobody know? That's what they count on when they just prescribe that shit all willy-nilly. They count on the fact that nobody knows what the fuck steroids are for, what the fuck they're doing, and why they're so detrimental. You know, there's this idea in medicine about, what's it called? It's tied to the Hippocratic Oath, the first being do no harm, right? And so in do no harm and like informed consent becomes necessary so that the patient has the power to weigh whether the treatment for the condition, the benefits of the treatment outweigh the detriment of the condition. But if the treatment potentially is more dangerous than the condition itself, then the patient needs to know that. This is a gamble that you're taking. This is a risk that you're taking because the side effects of this said therapy, treatment, pharmaceutical, surgery that we want to do is potentially as dangerous, or the side effects are potentially long-term relative to the condition that you're being treated for. They rely on our general ignorance about what these medicines do, especially antibiotics and steroids, which are the two most overly prescribed medications. They are huge contributors to what we call, oh my God, what's the word? I can't remember the technical word, but it's death by treatment. Ooh, what is the word? Child, that's one of the side effects of COVID. My brain has never been as quick as it was before I got sick with COVID. But I'm telling you this is because the reason I got COVID is because I was in the hospital. It's not because of being in the hospital. It was because of the treatment that was required to get me out of danger. And I knew it when they put it in. I was like, I'm going to get sick. I'm going to get sick. 2 years surrounded by COVID and never got COVID. And 3 months after I got out of the hospital, I got COVID. And I was knocked down from it. My dick was in the dirt. That's a Southern saying for those who don't know. I was down hard from COVID. But the reason why was because this strong Wei Qi that I had always been boasting about how I don't get sick but once every 3 to 5 years, maybe. I don't even get a common cold. Was because all of that Wei Qi was undone by steroids and antibiotics. Not the general little antibiotic that you've taken over the counter, which does damage. But I was tied to a drip for 3 days, unending, of steroids and antibiotics. Every ounce of what was redeemable, ass-kicking bacteria and good guys, squad me up on my health, on my Wei Qi, was destroyed in those 3 days. And here it is 4 years later, and I am still feeling the impact of the steroids. Steroids are a dangerous medicine. Their creation in the world was necessary. It was timely. It was really one of the great miracles of modern medicine, steroids. But it quickly became the singularly most overprescribed medication in the materia medica. That's not miotics and steroids are the two most overprescribed medications out there. And there are 54,000 pharmaceutical medications on the market. And so knowing this and knowing that in the moment, and that's what steroids are for, only for life-threatening emergencies. You are in imminent, immediate peril, and your life will not be saved without steroids. That's it. It's the only that was the way it was created. It's the only reason that you should be being prescribed steroids. But now we are prescribed steroids for everything. Unless it says non-steroidal inhaler, if you have asthma, if you have any type of respiratory distress that you've been prescribed an inhaler for, your inhaler is steroidal. You understand? If you have had hemorrhoids or any kind of rectal distress, I don't want to be, gross or graphic, but I'm talking as a medical professional. If you have ever had hemorrhoids or any other type of rectal distress, and what I mean specifically by rectal distress is if you are a male homosexual or if you are a female that engages in anal sex, then typically it is not uncommon for you to suffer from rectal distress. Hemorrhoids being the lowest level of rectal distress from anal sex, but lesions, abrasions, all kinds of things can happen when you are engaged in anal sex. And not typically, damn near 100% of the time, the primary treatment for rectal distress or hemorrhoids is corticosteroids. There are several people who get blood transfusions. Even if you don't know it, say you're in a car accident, you lose a lot of blood and you got to get a blood transfusion. Most people do not know that they have to get steroidal injections prior to receiving somebody else's blood so that they don't have an adverse event. So you have to have steroids. People who get organ transplants, they are on steroidal therapy sometimes for years so that their bodies do not reject the organ. And a coma, you don't remember. I don't know what that means. I don't know what you're talking about. A coma. I don't, Moni, I don't know what you're talking about. Be a little bit more specific. But anyway, there are people who receive organs who some are on steroidal therapy for years. Some are on steroidal therapy for the rest of their lives so that their bodies do not reject the organs. Do you understand? Now, let me tell you why steroids are used in this multiplicity of ways. For people overly being prescribed steroids, if they have like allergies, if they have constant, oh, okay, I see what you're saying. Yeah, she's saying if you end up like in a coma, you may not remember, and they won't tell you that you have had steroidal injections. So there are a multiplicity. Oh, pain. That's the common thing is people are accustomed to getting steroidal injections in joints. Like if they've been injured. I had a steroidal injection in my shoulder. It was cortisone. Cortisone is a steroid. It's a corticosteroid, right? Around the same time for a car accident, right? So people get it a lot for like knee pain. If they've had knee surgery, they keep chronic knee pain. And so they'll go and get cortisone. And we don't think anything about it. Oh, well, the doctor said it's okay, so it must be okay. Cortisone injections in your back if you got, back issues and shit. These are all steroids. Now, the reason that you get, yes, somebody says I was getting steroids for pneumonia and had them within the last 3 months for bronchitis. Thank you for, I ain't even told you yet, Tina, Cole. I ain't even told you yet, baby. The reason that corticosteroids, glucose steroids can be used, quote, for pain, for respiratory distress, for any number of issues is because the number one primary medical purpose of steroids is to shut your entire immune system down. That's a period, by the way. It's to shut your immune system down, to shut your immune system off. So whether it's treatment for pain, whether it's treatment for rectal distress, whether it's treatment for asthma, when you have an asthma attack, this is an immune response. The swelling, the itchy, the things that we call allergies, these are indications of an immune response. They're actually indications that your immune system works, right? So if you get like itchy eyes during your allergy season, or chronic runny nose, or postnasal drip, or you have difficult breathing, shortness of breath because your bronchioles are constantly getting inflamed or whatever, right? And so the doctor says you need to use a steroidal inhaler. It is to shut off the immune response. It's not addressing what caused you to have these symptoms. The symptoms are telling you, pay attention, something's wrong. But what we do in Western medicine is to, quote, treat symptoms, is to shut down the emergency system. The immune system is the emergency system. Any symptom that we have is an alarm call of our immune system. But because we have been conditioned to think that the symptom is the disease. Oh, I have allergies. Well, what are you allergic to? Well, I just have allergies, like seasonal allergies. Okay, but that doesn't explain, one, why you are so sensitive where other people may not be, and there's something that you need to do. But all of these symptoms that you treat like a disease, they are symptoms. They are your immune system working, alerting you. I got itchy eyes, something's wrong. I got postnatal drip, something's wrong. I got swollen bronchioles, something's wrong. It's not asking you. These symptoms are not telling you, oh, please stop the symptoms. The symptoms are telling you, please go deeper. Something deeper is wrong. Y'all ain't hearing this word I'm preaching. I know I came up on here to preach today. Your immune system, at the point that, at the juncture that you are experiencing symptoms, this is your immune system working. Most modern care is management. It's not treatment. It's not treat to heal. It's treat to manage. It's treat to make you comfortable with whatever is going to keep you coming to the doctor long term. Do you understand? So when you, Tina Cole, say that you were getting steroids for pneumonia, the steroids did not cure what caused you to develop pneumonia in the first place. It helped suppress the immune system enough that you were not experiencing the discomfort from the condition. Do y'all see the difference in what it is I'm saying? When you have allergies, that's just the easiest example to use. When you have all the little symptoms from allergies, right, that make your life hell, constantly blowing your nose, like I have a family with a long history of, allergies. And so it was not uncommon to hear people like trying to scratch their throat with their tongue or whatever they do, whatever. It was crazy. It drive me crazy, right? Like that, trying to scratch their throat because of that constant postnasal drip or whatever. These, again, are your immune system attempting to get your attention that something deeper is wrong, that this is just us calling your attention to something that is wrong. So, for example, when I was in Florida, I had a friend who his seasonal allergies literally came at the change of every season. It wasn't like some people are just like, okay, the fall kicks my ass, or the spring with the pollen kicks my ass. Every change of the season, his ass was getting handed to him because he worked outside. And so I do a protocol called the allergy treatment. It's intense, you feel me? But I do this protocol for people called the allergy protocol. And baby, it works magic. This guy had been on all kind of medications, and I was telling him these medications are not helping you. As a matter of fact, they are guaranteeing that you are going to be sick longer than you need to be. That these steroidal responses to allergies are destroying your immune system, because that's what their purpose is to do, is to suppress the immune response. Allergies is not a disease, baby. Allergies is an immune response. Two different things. You feel me? Asthma is not a disease. I know y'all don't want to hear that. Asthma is not a disease. It is an immune response. Something deeper. You understand? And so on and so on and so on. So when you're constantly taking medications, that's how steroids work. That's why they work. So the reason I say that the only reason that you should be using steroids is in imminent peril is if your life is in danger to the extent that you will not survive without its intervention. Cool. Steroids. You feel me? But the reason why steroids work, and the reason that they're supposed to only be used in life-threatening situations, is because the way that they work is they suppress the immune function until the immune response. Because if you're swelling or if you're excessively bleeding, or then it may make it difficult for a surgeon to do surgery if the tissues are swelling in response to whatever trauma or whatever it is that you've dealt with, that you are confronted with. Like my throat, it is difficult for them to do the little freaking trach, what do you call it? The fucking trach thing, because my throat was completely closed the fuck up. So they had to do this radical blast of fucking steroids to get the swelling. Like I said, they had to cut my clothes off of me because I'd swollen up so fast. They'd be like, oh shit. Right? So in these emergency situations where your body in crisis, because it is self-preserving, your body has everything that it needs to self-preserve, to protect itself. And so when tissues swell, when you have excess, it's the body's attempt to maybe stop radical bleeding. It's the body's attempt to keep anything else from coming in. All of these things are immune responses in the body's attempt to in real time preserve life. Like when they tell you, like if you go skiing or some shit and you out there too long, the body says, okay, some of these things are disposable. We can get rid of some toes. We can even get rid of some fingers. We can get rid of some arms, but the core is what's important. We'll divert all the warmth from the limbs, even from the nose and the ears, everything that's not necessary for the preservation of life immediately. We'll divert energy from that to attempt to keep the core warm until somebody come and rescue us, because this is where life is. And these appendages, we can let go of them. You feel me? The body is always in a process of adjusting to the environment to attempt to preserve your life. And so now everything that we call modern medicine is an attempt to slowly, over time, chop away at that ability to self-preserve. Every medicine, every pharmaceutical, everything that we take is slowly chopping down the body's ability to self-preserve, to self-repair, because the primary medications that we are prescribed are antibiotics and steroids. Their function, their purpose is to suppress the immune system. Steroids specifically to suppress the immune system. Antibiotics kills the immune system by its function, which is to kill all bacteria in the gut, in the small and large intestine. Well, in the large intestine and the small intestine has to be full. And so it's ironic that the way we learned about this in medical school was that your gut, your large and small intestine, it's always land. It's always territory that is looking to be colonized. So is it going to be colonized by microbes and bad guys and bacteria and candida and protozoa, or is it going to be colonized by good guys, good bacteria, and a healthy gut biome, right? So when you take antibiotics or microbials, you kill everything, good guys and bad guys, in your small and large intestines. And to give you an idea of how impactful that is, together, end to end, your small and large intestines is the length of a tennis court. If it was stretched out and connected to one another, the small and large intestines combined is the length of a tennis court. That's a lot of territory. That is our number one location for the majority of what we call our immune function is in our small and large intestines. So when we take just a single course of antibiotics, that's because we sick and we haven't figured out how to not be sick without taking a goddamn antibiotic for everything. You get a damn runny nose and your ass is going to get a prescription for antibiotics. Every time you take antibiotics, you're destroying the natural biome, the natural. Think about it like this. Your gut, your small and large intestines, it should be a tropical rainforest of goodness. Oh my God. I have to remember this analogy. Hold on. Your gut should be a tropical rainforest of goodness. It's a great metaphor, actually, because here is the gut. It's actually the metal element, which is the yin organ is the lungs. And look at here. The yang partner is the large intestines. So when I say that your gut should be a rainforest of goodness, and what do we know that rainforests do for humans is provide wonderful, beautiful, quality breathing air. Isn't that what it does? Isn't that what the rainforest does? So when you cut down the rainforest, right, in the large intestines or in the world, it impedes your ability to breathe well because the quality of air is now compromised because the good trees, the good forest is gone. And you see this relationship between the large intestines and the lung. If your gut biome is jacked, that's probably why you have asthma, first of all, or any respiratory issue of any kind, or why you got allergies, or why you sniffle all the time, or why you got postnasal drip, or any of that is because your gut biome is fucked. Okay? It's such a great analogy because, what is it? 86% of our immune function is unfolding in the large intestines. What happens when you cut down a rainforest? CO2 increases, people get sick more easily, whatever, hole in the ozone layer, whatever, right? In our bodies, how in the hell, I was going to read a book to y'all. Anyway, but this is important. It started off with a gripe, but this is important because nobody was talking about this. Nobody was talking about the fact that even as we were at home fighting this mysterious disease, how the earth responded kindly to our absence. 17% decrease in CO emissions in the city of Los Angeles alone. 17% decrease in emission in the first 3 months. 3 months. That was a headline in the LA Times. 17% reduction in CO2 emissions in Los Angeles after people were forced to sit their ass at home. The earth was responding kindly, gleefully to our absence. Ain't nobody talk about that though, and the impact, the potential good impact that could have on our respiratory system. You understand? Anyway, then I started off by saying, okay, well, why is this important? All of the shit that was happening with COVID, right? And the three main things that I knew were going to contribute to this being worse than it potentially had to be was because we have this relationship between the lungs and the large intestine, good biome, good healthy bacteria, you feel me? Meanwhile, people are taking experimental fucking vaccines, antibiotics every time they got a sniffle, whatever. And that was having a negative impact on the lungs that were already having the obvious issue, which was this mysterious virus. The organ that is so this is the mother in this scenario. Metal is the mother to water. And I was talking to you earlier about shock, fear, and fright. Acute shock, fear, and fright damages the water element. And the water element governs head hair, which is why everybody's hair was falling the fuck out. I was treating like 8 people in the first 3 months of COVID who were like, One girl had the longest, most luxurious hair. I was like, what do you mean your hair is falling out? Is it like thin? And she started lifting up patches of her hair where her hair had been coming out in giant clumps all the way to the scalp, out of nowhere. Never lost no hair. And all of a sudden, she's losing hair everywhere in clumps. You feel me? That is the impact of acute fright, shock, and fear on the kidneys, on the physical kidneys, on the water element. And the water element is mothered by the lungs. So this thing that was happening here with, and then the last thing I'll say about that is the external sense organ of the water element is the ears and the head hair. The external sense organ governed by the lungs, child, is the skin. So here we are in the height of a condition that is a respiratory condition that would tell us, if we knew, that instead of isolating, we need to be touching each other more. We need to be hugging each other more. We need to be even if we're masking and taking those kind of precautions, we are only doing more damage if we do not touch. And I was living in a house with people who ate dinner together all the time, hugged and all that stuff all the time. And as soon as COVID happened, people were self-isolating in their bedrooms, in the house. That shit was wild to watch, because I know touch deprivation and skin starvation. This is not my conjecture. These are scientific studies about the long-term immunosuppressing impact of touch deprivation and skin starvation. Skin being the external sense organ of the lungs. So the things that we could have done to, as a matter of fact, remember there was a woman who started making a grip of money because during the height of COVID, she launched a hugging business. She launched a business as a professional cuddler, and she was charging $225 an hour, and she would prepare a meal and have movies selected, and people would come to her house, and she would literally like a mama sit on the couch while the person laid their head in her lap, ate meals, and watched movies while she just cuddled them like babies. And this girl was making a killing, even if she don't know the science and the pathogenesis of the relationship between the lungs and the skin, and how skin starvation and touch deprivation made worse an already dire situation with COVID. It made worse. That's not my opinion. Even Western medicine, after all these years, is finally conceding the relationship between the skin and the lungs. Children born premature where their lungs have not fully developed are 10 times more likely to develop skin issues, psoriasis, cradle cap, eczema. If a child has childhood asthma, they're several times more likely to develop skin issues like psoriasis, eczema, and so on and so on and so on. That's according to Western medicine. You feel me? They know this information. I want y'all to know, because Chinese medicine has been being practiced in the United States as a legitimate system of medicine since Nixon's. As a matter of fact, Nixon was the one, quote, responsible for allowing Chinese medicine to come into the United States, like allowed people to come and build schools and all that shit. It was under Nixon's administration. Since 1974, Chinese medicine has been a philosophy that has existed in the United States. And you better believe, because I know the state, they don't leave no stone unturned, especially the state as the American Medical Association, especially the state as the CDC, the Centers for Disease Control, especially the FDA, especially the World Health Organization. The World Health Organization right now, its own website, details the top 100 diseases effectively treated by using traditional Chinese medicine. Don't you know they know this philosophy that I'm teaching y'all? They know it even if we don't know it. And don't you know, if they know that this 6,000-year-old system of medicine has worked efficiently at prolonging the life of the whole 3 billion plus Chinese people, that they are going to be creating institutions and apparatuses to counter its efficiency? I'm just telling you, I think that deep because I know my enemy does. They know Chinese medicine. They know the pathogenesis based on Chinese theory and Chinese medicine. You see all these goddamn big ass books here? Y'all see these books? Books. All the 4, 5, 10, 15, 20 shelves of nothing but Chinese medical theory. There are over 100,000. 100,000. So while people still saying I practice voodoo because I practice acupuncture, meanwhile, there are more than 100,000 peer-reviewed, double-blind, researched articles on the efficacy of traditional Chinese medicine. But we still think it's just for back pain and it's some voodoo shit. So, anyway, I'm going to pick up one of these days with the next organ system, because I started teaching y'all 5 elements theory about a month ago with the spring season. I may just do it like that. I know it's exciting. I don't know. I'll debate about it. I was thinking about like just doing it at the transition of each season, but y'all can wait. Y'all can wait. I think I will do that. So the next time I will be doing a lesson on or a workshop on 5 elements theory will be when we transition into the summer season, which is going to be January 20th. I think June 20th this year. So I think I'll do that in preparation for our transition into the summer season. And maybe I'll do one more workshop on the wood element, the spring season that we're in, because I talked a lot about the theory, but I didn't talk as much. I talked a little bit, but not as much about like functionality, what to do, what to eat, how to, what kind of activities are optimal during this time of the year, like what kind of detoxes, if that's what you want to do, are really beneficial for the liver without injuring the spleen, right? We talked a little bit about that. Yeah. So I think I might do one more workshop on the wood element, the spring season in 5 elements theory. And then I'll table that until June when we get ready to transition into the summer season. What those organs are, what those foods are, how to behave, what that means, what are the implications, what's the internal sense organ, what's the yin organ, what's the yang organ, I think I'm going to do that because it's only every 3 months. So actually, there's a 5th element that happens between 2 main elements. So yeah, every 2 or 3 months. With the transition of a season, I will do another season on the 5 elements chart and teach you everything about it so that you can, again, become the full owner and possessor of your own health outcome, because you can be. You feel me? Let's see, I've had a part of my large intestine tract removed because it was twisted, as well as the rectum because it was damaged during, wow, sis, man. Man, I hate to hear that. And that's, so let me reiterate also, by the way, that I do complete wellness consults based on 5 elements theory. That's the wellness consultation that I do. It is an hour long. I send you a full write-up of your diagnosis and how to approach your health journey based on that diagnosis. It takes me about 5 to 7 days to pull that together because it has everything, all the nutraceuticals that you will need, any potential nutritional deficiencies and how to address those. It will have any Chinese herb formulas that you need to be on and the duration of time you need to be on those. It'll tell you everything, baby. It'll completely demystify who you are in the moment, in the present, right? And how to adjust accordingly, how to use what you have inherently in you and around you to adjust accordingly and to take possession back over your body. You feel me? So that's what I would suggest to you, sister, is to reach out to me. You can email me at releaseheartcenter@gmail.com for your wellness consultation. If you're more interested in divination, you can also releaseheartcenter@gmail.com. Put reading in the subject header or put consult in the subject header, depending upon what you're reaching out for. If you have questions, general questions, my time is valuable, man. And I like to teach, so I have a hard time, but my time is valuable. And so, short questions. Don't ask me to make dissertations about a question that you have for me. You feel me? Email me at releaseheartcenter@gmail.com. I'm pretty good about checking my email 3 or 4 times a day. So you will get a pretty quick response from me. I'm going to have to close this out now because now I got to go to this appointment for my this tax bullshit. Feel me? I'm dreading like the plague. But anyway, yeah, so that's all I have for you today. I still may come back today and I'm going to definitely come back today and do this read a parable of the sower, because I am determined that we are going to finish this book by Thursday so that we can start this other book that I'm too hype about called The Great Black Mama of Creation. This book is so gangster. I read this book in a day, and actually like a day. I was in it, right? So that's the next one we're going to start reading on Friday. Great, Tina. I'm glad. So yeah, I look forward to hearing from you. Anybody else? Again, my email address is releaseheartcenter@gmail.com. Those of you tuning in from IG, I really, really encourage you to go check out my YouTube channel, which is at Daughter of the Fates, Fates, Daughter of the Fates, at Daughter of the Fates, in YouTube. Like, share, subscribe. Watch the boring ass ads. That is how my page is monetized, is through the ads, but you have to watch them through. If you skip through them, I don't get money. And if I don't get money, I have to go out in the world and get yet another job to support my life while I'm trying to change the world. Okay. So watch the ads. Yes, they may be 10 minutes long. Put it on mute, go get a sandwich, come back and watch my video. Okay. It's a small thing to ask. My page is also monetized, so at the bottom of the screen you can see the ways that you can support. You can do a super chat while you're watching. If you find the information valuable, send $1.99, send a super chat for $2.99, send a super chat for $5.99. Be ambitious, send it for more. I had a woman from Australia last week send me a $200, it was a 300, it was Australian currency, but it was a $300 super chat. That I respect that. You feel me? We spent 2 hours on the phone. She was paying for her reading. She sent $100 super chat and then the $300 super chat for the reading. And we spent 2 hours on the phone, but it was awesome. And I really appreciated and respected that. You feel me? So these are the ways that you can support. It's important that we support each other. So I'm not asking you to do for me what I don't actively do for others. This is the only way we're going to make this shit pop. It really, really is, man. We can't keep having to struggle with capitalism, struggle with how we are constantly, chronically being exploited under capitalism. For every amount of money we make, we get a raise, and they feel like they entitled to our raise. Like there's no getting ahead in this thing. And the only way to do that is to divest in a massive way. And the only way to be able to divest is to support among one another. So I told y'all at the beginning of the month that my act for the month, and probably ongoing, truth be told, is to only support BIPOC businesses. Period. This month, especially this month, I'm not spending my money except the necessary money. Like, you know, they got a monopoly on gas and water and gas in your car and the rent man, you feel me? They got a monopoly on that shit. So you can't not give your money to white people because they govern all that shit, you feel me? But everything else, my money is only being spent with primarily women of color. But even like my favorite little neighborhood bar is owned by a white guy. Nice guy. I love the bar. I'm typically there 3 days a week. I said, but for the month of April, he can't have my money. He can't have my money. My money is going to some black, brown, red, or yellow person. You feel me? That's it. And so this is the way that we support each other. This is the way that we can divest in a way that we can still live comfortable lives. We can still live bountiful lives and not be attached at the hip to capitalism. You feel me? Joint at the goddamn hip and all they wicked ass ambitions around the world right now. So support my shit. Just like when you support my shit, a great percentage of the money that I spend, I don't have any disposable income, but my like income that is not tied directly to some bill as soon as I make it is going to some BIPOC organization or some BIPOC business. That's a guarantee. So with that being said, like I ain't even, listen, my palate has changed in the last 2 weeks because of this, because I'm like, I can't support nobody who ain't black, who ain't red, who ain't brown. You feel me? So my palate has changed a lot. especially like late night when I'm looking after I had a drink. You feel me? Like now, looking for something to, curb my hunger at the late night. I'm actually having to go search. Last night I had to go look for a street vendor because I was like, dang, I can't eat none of this shit. That's commitment. And I'm being funny, but I'm being serious at the same time. Support the channel. Right now, the @Daughter of the Fates YouTube channel is my primary method of getting the Temple of Evolutionary Emergence out there. There's some things I'm working on this week. Some grants I've been made aware of locally here in Los Angeles City. We are a 501c3, a religious 501c3. So hopefully I'll be able to break through this lull that we've been in the last year so I can make better moves. But money is the only way that I can make the moves that I need to make. I need to be able, to seek more money. And to seek more money, I need more money. It's the thing. It's the shit. It's the web. But no, that's the commitment that I've made, is I'm only spending my money. Oh, that's the other thing. So if you have a business, if you're a business owner, we should all know that. If you're a business owner, you have a business, you have a product, always feel welcome to post that in the comments. And I will, just like, with some of the other stuff I do, I will take and, show that like across the bottom so that people have the information necessary to support you. Okay. So all that being said, I'm going to take off now. I appreciate you all. I thank you for your comments and your questions. Feel free to reach out to me at releaseheartcenter@gmail.com. And probably maybe, let's see, I have a sitar lessons tonight. So maybe around 4, I will do a live, and that'll give me enough time to leave for my music lessons. So yeah, I'm going to go ahead and do another notification, and y'all can join me back at 5 p.m. Pacific Standard Time for the continued reading of Parable of the Sower. I'm sorry I went off like that, but I'm glad I got it off my chest. Take care. Hug somebody today. Be well. Be bountiful. Go outside. Hug a tree. I love you all, and I'll see you again in a few hours. Peace.